Cancer. Cancer is a group of diseases characterized by the development of abnormal cells that divide uncontrollably. Abnormal cells can enter and destroy normal body tissue. Between 2010 and 2020, the number of expected new cases of cancer in the US is expected to increase. 24% of men, 21% women, and cancer death rates are also expected to increase. 15.2% of men and 8.1% of women. Increases are expected to increase specifically in melanoma, which is a deadly skin cancer, in white men and women, prostate, kidney, liver, and bladder cancers in men, lung, breast, uterine, and thyroid cancers in women, and by 2025, cancer is projected to be the #1 killer of Americans. Lung cancer is the #1 cancer killer for both males and females, and new cases of lung cancer is stable in men but increasing in women, and 1/3 of all cancers is due to tobacco use. Cancer has now overtaken heart disease as the leading cause of death among middle-aged adults in several countries, including the US. Dietary factors are also associated with the development of some cancers. On the other hand, a healthy diet and medical nutrition therapy are important to the recovery of the cancer patient. Cancer development. Cancer begins with damage or mutation to your cell's DNA. DNA is like a set of instructions for cells, telling them how to grow and divide. And normal cells often develop mutations in their DNA, but they can repair most of these mutations. If they can't make the repairs, however, the cells often die. However, certain mutations aren't repaired, causing the cells to grow and become cancerous. Mutations also cause cancer cells to live beyond a normal lifespan, and this can cause the cancerous cells to accumulate and spread to other parts of the body. Stages of cancer development. 1. Exposure to a carcinogen, another name for cancer-causing agent. The entry of the carcinogen into the cell. Change inside the cell or the initiation phase. Facilitation of cell growth to form a tumor or the promotion phase. And then the tumor progression or metastasis. Diet and cancer. 80 to 90% of cancers are related to environmental factors, 35% of which are related to diet. Diet influences the rate at which cells multiply through the availability of energy and essential nutrients. Some dietary components have hormonal effects, and many scientific studies have demonstrated that dietary habits affect the risk of certain cancers. Diets high in fruits and vegetables can reduce the risk of cancers of the lung, mouth, larynx, pharynx, esophagus, stomach, colon, and rectum. Some nutrients like vitamin A have physiologic roles in regulating gene expression. And some nutrients like folic acid have a role in the regulation of cell division and proliferation. Overweight and obesity are associated with increased risk for cancers of the breast in postmenopausal women, the endometrium in women, colon and rectal cancer, kidney, the pancreas, and the esophagus. Also associated with cancers of the gallbladder, liver, cervix and ovary, non-Hodgkin's lymphoma, multiple myeloma, and aggressive prostate cancer. Alcohol consumption is an established cause of cancers of the mouth, pharynx, larynx, esophagus, liver, colon and rectum, and female breast. There's also evidence linking alcohol use to pancreatic cancer. Alcohol consumption interacts with tobacco use to increase the risk of cancers of the mouth, larynx, and esophagus considerably more than the effect of either drinking or smoking alone. There is also evidence linking alcohol use to pancreatic cancer. Alcohol consumption interacts with tobacco use to increase the risk of cancers of the mouth, larynx, and the esophagus considerably more than the effect of either drinking or smoking alone. Fats. Dietary fats affect the promotion stage of cancer development. High-fat diets are associated with cancers of the breast, colon, prostate, ovaries, and uterus. Protein and red meats. Diets high in protein, especially from red meats, are implicated in tumor growth. Tumor growth is suppressed by diets lower than the RDA for protein, but enhanced by protein levels 2 to 3 times the RDA. And high meat intake may increase the risk for colorectal and breast cancers. Diets low in fiber are associated with cancers of the colon and rectum, and 25 to 30 grams a day are recommended. Antioxidants have a protective effect on cancer by preventing free radicals from damaging the cells. Vitamin A and beta-carotene for the prevention of cancers of skin, breast, esophagus, respiratory tract, pancreas, and bladder. Vitamin C for the prevention of cancers of the stomach and esophagus. Vitamin E for the prevention of lung cancer. Selenium inhibits DNA synthesis and it enhances the immune system. Calcium for the prevention of colon cancer, and vitamin D also for the prevention of colon cancer. Cruciferous vegetables, and these include broccoli, cabbage, cauliflower, collard greens, Brussels sprouts, and kale for the prevention of colon cancer. Green teas are high in an antioxidant called catechins and free polyphenols, especially flavonoids. And they may selectively inhibit the growth of cancer. Coffee, there is some evidence on the population, but not at the individual level, for pancreatic cancer. Essentially, countries that have very high coffee intake also tend to have a higher prevalence of pancreatic cancer. How food is cooked also may play a role in cancer, and certain cooking methods may produce carcinogens. Curing, smoking, pickling, charcoal grilling, and blackening. Food preservatives. Nitrates and nitrites are converted to nitrosamines and nitrosamides, respectively, and these are found in processed meats and cold cuts. Cancer prevention guidelines. Choose a plant-based diet rich in a variety of fruits, vegetables, legumes, and minimally processed starchy foods. Achieve and maintain a healthy weight, and limit weight gain during adulthood to less than 11 pounds total. Get nutrients from whole foods, not vitamin supplements, and participate in moderate physical activity at least 3 times a week. Limit intake of processed foods, especially processed meats and cold cuts. Consume at least 5 servings a day of fruits and vegetables, and consume more than 7 servings a day of a variety of grains, legumes, and root vegetables. And the emphasis again, use minimal amounts of processed foods. Limit consumption of refined sugar, and alcohol consumption is not recommended, but if consumed, it should be limited to 1 drink a day for women and 2 drinks a day for men. Limit red meat to less than 2.5 ounces a day. And choose fish, poultry, or meat from non-domesticated animals in place of red meat. And limit consumption of fatty foods, particularly those of animal origin. And we also emphasize, choose modest amount of appropriate vegetable oils such as olive oil and canola oil. Do not eat foods which have been stored for long at high temperatures. Do not eat charred food. Limit intake of flame grilled, cured, and smoked meats. Do not smoke. And women should breastfeed their children since it has been shown to reduce the risk of breast cancer.